Good afternoon, everybody, and welcome to the webinar. We are in the second week of our month-long mental health and cardiovascular disease webinar series. And today we are reaching a new topic, which is after your diagnosis, building your support network, why it's important, how to do it, and some tips and tricks on how to make it successful. Before we get started, just a few topics of importance. All attendees are in listen-only mode, so if you cannot hear, please, hopefully you can read the slides. Check the audio button on your personal computer to assure that your sound is on. Please type your questions into the Q&A box at any time during the presentation, and the moderator will read your questions during the Q&A period. A PDF version of the slides, as well as a recording of this presentation, will be available on the Mended Hearts website following the event. And there will be handouts available in the handout section or in the chat section of the website. Leslie will begin putting those in momentarily. So if you aren't familiar with Mended Hearts, our mission is to inspire hope and improve the quality of life of heart patients and their families through ongoing peer-to-peer support, education, and advocacy. And my name is Andrea Baer, and I am the Executive Director here at Mended Hearts. And today we're super excited to welcome an old friend back, Jessica Daly, who is the Head of Collections and Electronic Resources of the R.A. Williams Library for Advent Health University in Orlando, Florida. And she's also a health literacy advocate. But she's our friend, and she's full of wonderful knowledge, and we're so excited that she's here. So I'm going to turn the presentation over to her, and I'll be back for the Q&A session.
All right. Okay, well, I'm gonna get us started. Thank you guys so much for letting me be back with you. I really am excited about this topic. I'm very excited just about the positive promotion that has been taking place, I think, all across our country when it comes to mental health. And so I am just so excited that now it is, becoming something that people don't ever have to feel ashamed of, that they can actually speak out about and actually receive help and treatment for that. And so after any diagnosis, but especially a cardiac diagnosis, there is a lot of stress, anxiety, and just strain on your mental health. And so we're going to talk about that today and talk about what to do after diagnosis and how to build that support system. Okay, so Andrea, I'm not sure. Are you guys moving these? Okay, perfect. Awesome. I will alert you. Perfect. So I wanted you to see a little bit about me. Like, who is this lady that's talking to us about this, and why should I listen to her? Well, a couple reasons. Number one, you see my family here, and the handsome guy beside of me with my dogs and our daughter is Brian Daly, and he is actually my reason that I am so interested in not only being a caregiver, but also cardiac health. And that's because 16 years ago last week, we celebrated his 16-year heartiversary. That's what we call it. And that was the day he was diagnosed with congestive cardiomyopathy, or in other words, it was heart failure. And so at the age of 28, getting that diagnosis, you can probably understand at any age that it is very upsetting. It's very life-altering, and our world as we knew it changed. But guess what? Our world has been awesome for the past 16 years. Now, that is not to say that we have not had some really dark, hard moments, because that is, unfortunately with chronic illness, that happens. I call it the roller coaster. And so, this is just really near and dear to me. I've seen what we've gone through after diagnosis, what he's gone through with his mental health. And so this is just really near and dear to me. I'm also a medical librarian and an academic librarian in a medical university here in Orlando. And so not only do I work with the community like I'm doing with you today, I work with physicians, I work with patients, I work with students now, which I have missed the past few years. And I also, am now involved in training and helping new medical professionals know the importance of health literacy and just understanding your health better. Okay, so moving forward, I want us to start out by talking about what health literacy is. So this is a term that is sometimes misunderstood. It has nothing to do with literacy as far as being able to read or write. It has everything to do with understanding your own health and your diagnosis. So this means just the level at which you understand your diagnosis, your medication, your treatments, your self-care. So how well you understand your health. And with that comes your ability to make decisions about your health and to take the right actions and be a part of your caregiver team. So I always like to talk about that at first because that's what we're doing right now. We're increasing and improving your health literacy. So I love this graphic. I love to show it. How do we want to feel as a patient? We want to feel empowered and we want to feel understood. We want our medical team to value our opinions, value us as the one that is going through whatever it is that we've been diagnosed with. And so we have to be well informed. We have to educate ourselves and really become experts on our diagnosis. And, that is an ongoing process. Please know that. We've been in the process with heart failure as a family for 16 years, and it is very different today than it was at diagnosis. So, it's an ongoing learning experience. You want to have that good rapport with your medical staff. You want to be able to make good decisions. And with that comes finding the right information. And so today, not only am I going to share information with you, I'm going to share where I get this information, and everything I get are free resources that you can access online and learn more even after this session. Okay, so we've talked about the good part of increasing our health literacy, but I have to be honest with you and transparent and tell you that a study with the CDC, or Centers for Disease Control, really, put this to the test, and they began to look at patients that didn't understand their health. And this is what they saw across the board. Number one, more emergency room visits. Number two, more hospital stays within the year. Number three, they were less likely to follow their treatment plan, not because they were trying to be defiant to the wishes of their healthcare team, but they really didn't understand what to do and why it was so important to do it. And then in the end, number four is that we see a higher mortality rate with these patients. So patients that don't understand their health have a higher risk of death. Okay, so we're moving into our topic. Now we know that we're improving our health literacy. And now today, our goal is just to talk about life after a diagnosis, or life after heart disease or a heart event. And so, of course, if something like this has taken place, you feel scared. And if you are anything like our family was, we were very overwhelmed. We didn't see this coming. This was a huge shock. It rocked our world. We didn't understand what we were even going to do next. In the matter of one weekend, my husband was told that if he survived, he would never return to work. And so as a two-income family, and I was a public school teacher, so that wasn't a big salary, and we had a 3-year-old daughter, that was a really rough weekend, and the weeks to follow as well, and really the years to follow in different situations. But it is a life-changing event. So please know that. Please know that it is normal to have these feelings. Also, after a diagnosis, you receive instructions and a lot of information from your physician or your medical team, and that can also be overwhelming. So I really encourage you to say to them, okay, what is most important for me to know now? Can you categorize what I need to be learning. Also be very careful of jumping in online and reading different things, because remember, anyone can go online and create a website, and it does not have to be authentic or credentialed in any way. I could do a website today and it's illegal, but I could say that I was a physician, give you information. So make sure that you are going to reputable sources when you look up things about your diagnosis. And also, after you've had time to reflect, let this sink in, trying to understand exactly what happens, you want to know you can avoid heart problems in the future. So you need to figure out what changes in your lifestyle or in your routine you can make. And then navigating this road to recovery is not easy. You may be hospitalized, you may be going for multiple appointments, you may be in types of therapy or rehab. So all of that is, part of life after a diagnosis. Okay, so we can move forward. Okay, so this is a pretty simple slide. Understand life has changed and it's okay. Let me just say, gets me a little emotional. Used to, and not anymore, but my husband used to say, oh, I wish I could go back to how life was. I wish it wasn't so different. I wish I weren't sick. But here's the thing, when we live in that place, we can't experience joy and we can't move forward. So while, initially, yes, you're going to feel that way, please understand that there is life after diagnosis, and there is a wonderful, beautiful life after that. It is different, but it can still be very good. So be open to that and understand that that is okay. That could be better than okay. It could be really a great restart, a refocus, just evaluating life, evaluating relationships, and just really thinking about what's important. Okay, so the first thing that we have to think about after diagnosis is taking our medications as prescribed. When we're supposed to take them, the dosages we're supposed to take. And let me just say that that can be very overwhelming. There can be multiple medications that you're having to take. I know at one point, not any longer, but at one point, my husband took 14 medications every day. So that is a lot to keep up with. And I said that was my part-time job, was taking care of health insurance and medications and appointments. And, it really is. And so you want to lower your risk of cardiac events, and you want to make sure that you are taking your medications properly. So learning how to manage those medications is very important. So here are the key people that I want you to think about when you're doing that. Have conversations with your physician and also your pharmacist. They're both great resources to talk with. Okay, now the biggie next is attending your follow-up appointments. This just helps doctors keep track of where you are, how your recovery is going, how your condition is. You can make the most of your time, and I talk to patients about this a lot, but preparing before an appointment is key. So let me just tell you, before an appointment, especially a cardiology appointment with my husband, we sit down the day or the night before and we write out any concerns, any questions we have. We really want to be ready for the appointment, because guess what? If it's like anything that we experience, physicians are being told by practices and hospital systems that they only have a set or limited time with you. So you want to maximize that time as best you can. So being prepared and having that list of questions is amazing. And I will say this too. All of our physicians we've had over the years and our medical teams, they love that we write things down and that we know what we need when we walk in the door. It also gives you a chance to write down things that the physician or nurse may share with you so that you can look it up or talk about it later as well. Okay, so cardiac rehabilitation is something that I encourage. If you are offered the chance to do it, please don't refuse this. And if you haven't been offered this, ask about this, see if this is a possibility. And let me just say that my husband actually did cardiac rehab 2 different times, and he loved it. And here's the great part. He was afraid to exercise because of what had happened to him. And he was trying to keep his heart rate lower. His heart rate was resting around 150, which was very dangerous. And so he was afraid to exercise. And so this gave him the capability to exercise with nurses right there, hooked to heart monitors. They would be, with you, never leaving you, watching your progress. And it really gave him the confidence he needed to exercise on his own and learn what was safe, is what I was going to say, for him to do on his own. They can help you develop a program. So, it also gave him a chance to network and talk with and connect with other patients similar to himself. Camaraderie and being able to connect to people who have somewhat of an understanding of what you've gone through is amazing. So I do encourage it. But again, if you didn't go through this or haven't been offered cardiac rehab, ask about it. Hopefully it will be offered where you are. Okay, so we're going to talk about our emotions and how we can best, help ourselves after a diagnosis. So please understand that this is scary, and that's okay to feel scared. It's also very confusing, trying to figure out why this happened, or, what the cause of this was, how you can prevent this from happening again. If you're like my husband, he has had several episodes where his pacemaker has had to shock him and put his heart back into rhythm. That's a very scary situation. And I will say, has, had some episodes that have been very frightening. And so that is a fear he has, is his pacemaker shocking him. That is a real fear that he has. And so it's something that you want to talk about. You want to not live in fear all the time, but understand it is normal. But you can connect with other, this says heart attack survivors, but he's a congestive heart failure person. There's all kinds of things with heart disease, but there are ways to connect with other patients and caregivers, and there are support networks. So after a heart attack or a diagnosis, I'm going to add that in there, it's important to manage your risk factors. So this is going to be things like high blood pressure, high cholesterol. If you're a diabetic patient, handling those symptoms or those already, areas or diagnosis that you may have. So you need to take medications if prescribed. You definitely need to quit smoking. And eating healthy foods and being active really will help. What we put into our bodies has everything to do with our health, not only physically, but also mentally too. Okay, so what are some ways to manage heart disease? What are some things we can do after a diagnosis or after an event? The first thing we mentioned in the last slide is to eliminate tobacco smoke. And let me also add here, it's not on the slide, but if you vape, if you do e-cigarettes, they are very dangerous, very harmful to your health. So those need to be eliminated as well. You really need to take control of your blood pressure. You may want to start, and maybe your physician has mentioned to you, taking it a couple times a day, seeing, keeping record of it, seeing what foods may cause your blood pressure to go up, what situations, stress may cause it to go up. So you want to keep that blood pressure in a safe range. Now that is different for every patient, but what we call normal, or what we're shooting for, is 120/80. And so if it's much higher than that, that is definitely an area of concern and something that you want to get down. So it may mean medication, but it also can't just be medication. It also has to be lifestyle changes and what you eat as well. High cholesterol, that is associated with a lot of different types of heart disease. And so that's what causes our blockages. So we want to be very aware of what your cholesterol is, having that tested through blood work. And then making sure that if you've been given a medication, that you're taking that, but also making sure that you're being careful of the food you eat. Often when it comes to blood pressure and cholesterol, patients say, oh, I can do and eat whatever I want because I take a pill for that. Absolutely not. That pill is there to help, but it takes not only the medication, but what you eat and how you move your body. All those factors are going to help lower both of those things. Then just talked about it, physical inactivity. So maybe some patients say to me, Jessica, I'm afraid to get on the treadmill or I'm afraid to go walking. Well, again, that is a discussion to definitely have with your physician or your cardiologist. And that's another reason that cardiac rehab may be a great answer to help you get on a plan for physical activity. And then obesity. That's something that none of us like to talk about, but it is a real factor when it comes to heart disease. And so being in the range that we're supposed to be in is very important. And it's very critical if you are obese or you are heavier in weight than you should be, that become a factor, a real focus to prevent future episodes or future problems. And then diabetes. So we find very often that heart patients are also diabetic, and having diabetes is difficult in itself. But the lifestyle changes for heart disease are even more important with diabetes. And so hopefully managing both of those together is going to give you optimal health. Okay, so emotional support is key. Let me just say this. If you think you can do it all by yourself and on your own, I have to disagree with you. I think it is critical that you have emotional support. So this could come from family and friends. I tell people, be careful who you choose to share with. Not everyone is going to be a positive, encouraging, person. And so I want you to think about who is going to lift you up, who is going to fill your bucket, who is going to fill you up. Those are the people that you need to connect with and confide in. Professional help and support groups. Let me just say that I'm very transparent of being very pro counseling, whether that comes in the form of a certified counselor, a psychiatrist, a psychologist. I think it's very important that you have someone to talk with. And sometimes it's important to have someone to talk with that is removed from your situation, that can really give you, unbiased opinions and information and suggestions. So if you want to do that one-on-one, that's totally fine. But you can also do it in support groups that connect you with other people with similar diagnosis. And so after COVID-19, you'll find that a lot of support groups are online. And so that is something for you to think about and really invest some time in. But either way, whether you do both or you just choose one, it is helpful to have that support. And then you really need to connect with your cardiologist. And let me just say that that is a subject that I won't go on and on about today, but it is very important that you have the right cardiologist. If you do not feel like you connect well with your cardiologist, that you're not being heard, that you don't have good open communication, that you can't get in touch with them with questions, you may want to consider looking another cardiologist. There are thousands out there. And so I really do encourage that. I would tell you, on a personal level, we changed after 5 years being with one practice. We changed about 2 months ago, and it has been amazing. I think our cardiologist before was a great physician, but the way the office operated, we couldn't ever get in touch with him. We couldn't ever have our answers, get answers to our questions. It was very distant. We didn't feel as though there was any communication. And so that had gotten worse over the years. And I think with the increase that our old cardiologist had in patients, it's just, I'll just be honest, doctors have too many patients in a lot of situations, and it's hard to have that personal connection. So we went to a new cardiologist a couple months ago, and it has been like night and day. It is just very personal. My husband is doing better than ever. He's being taken off some meds that we probably didn't need to be on. They've helped him with his diet. They're very into holistic medicine as well. And I'll just brag about him. His glucose, he's hypoglycemic. His glucose levels have been evened out, and he's felt great, and he's dropped 15 pounds in the last 2 months. And so it is important that you're with the right doctor. Pets are so important. If you're not an animal lover, okay, I'll let you off on this one, but I am, and I'm just here to tell you that pets are a way to have emotional support. I have a Shih Tzu that she gives emotional support when she feels like it, even though I love her. But I have a golden retriever, and he is about 17 months. He's finally begun to calm down a little bit, but let me just tell you that he is my therapy dog. He loves to be loved, and he loves to be with me. And so just sitting with him, rubbing him, talking to him, it does amazing things for my stress level. And then your bucket list. Guess what? After diagnosis, you might say, there are things I've always wanted to do. Life is too short. Let's make a list and let's start doing some of these things. And it doesn't have to be skydiving. It could just be, you want to travel to another state, or you want to get I've always said I want a Vespa, the little scooters. Maybe you get a Vespa. It just depends on what your bucket list looks like. And then getting out. I know that some of you may not feel well, and you may not feel like getting out, but as much as you can, getting out, being with others, getting fresh air, even if it's on your front porch, a back patio, being outside really is important. Getting in the sunshine, it really does help with our mood. And then moving your body. And again, I'm going to be transparent with you as always. I don't enjoy exercise. I get hot, I get sweaty, and I get really tired. But I realize I have to do it. So I find ways to do it that I enjoy. So number one, I walk around the neighborhood with my husband. It's a time for us to be alone. It's a time for us to talk, laugh, share with one another, and we're moving our body. The other thing is we walk our dogs, but we love to swim. We like to go to our neighborhood pool. So just find things that you enjoy, but move your body. Okay, so how is mental health defined? I want to talk about that really quick. Mental health is kind of a grouping of things. It's your emotional, your psychological, and your social well-being. It affects how you feel, how you act, really how you cope with things. And it also helps determine how we handle stress, because I really hate to be the bearer of bad news, but stress is inevitable. It is coming our way every day, but how we react to it and the choices we make all the difference. And it's also important for you to understand that mental health is important at every stage of life. Definitely since COVID-19, we have seen an increase in mental disorders and mental health situations with people, and that is from small children all the way through senior citizens. So age does not matter when it comes to your mental health and it affecting your life. Okay, so here's a source that I want you to know about, and that is the NIH, which is the National Institutes of Health. And they have a division called the National Institute of Mental Health. And this is where I gained almost all the information I'm sharing with you today. It is a free online website for the community, for patients and families. And so these are all the health topics that you can learn more about on the website. So I wanted to give you kind of an overview of all of these. So depending on what you are going through or what your diagnosis is, there is great information on this site. All right, so let's talk about mental illness in the US and what that looks like. If you are experiencing any type of mental illness or mental disorder or even stress and anxiety, please know that you're not alone. Mental illness are common in the United States, unfortunately. Nearly 1 in 5 US adults live with a mental illness. And so that's a lot of people, over 52 million. And that was in 2020. So I have all ideas that number has probably increased. And so mental illness can include many different conditions. And then there are different levels of severity with a condition. So you might be told you have mild, moderate, or severe. And so depending on what level you are diagnosed with will also depend on the treatment plan that your physician comes up with. There are two broad categories. You might hear these from time to time. There's AMI, which is any mental illness, and there's also SMI, serious mental illness. And so if you hear those terms, that's what they refer to. And I also wanted to show you kind of a chart. This is from 2020, but it shows the prevalence of mental health among US adults. So when we take a look, we see that more females were identified in this survey. But let me say why that usually is. It doesn't necessarily mean that females experience mental illness more than males, but what it does mean is that females are often more prone to go for assistance, to seek out help. So that may be why that number is a little higher there. Then we look at the ages, and unfortunately, you can see that the largest age group here in this survey was 18 to 25. And we have seen since COVID-19 and the pandemic that this number has increased and that suicide among young people has increased as well. And so then we go to our race or ethnicity, and we see that, it's pretty close across the board with white or Caucasian being the top. But let me just say this. It really shows us that mental illness or mental health issues don't, have no prejudice. They happen in men and women. They happen in all age groups. They happen in every race or ethnic background. So it really is something that is universal. And it's also not just the United States. We see these things happening all across the world. Okay, so people ask me often, Jessica, do I have stress or do I have anxiety? What is the difference? Well, they really go hand in hand, because if you take a look here, both of them have excessive worry, you feel uneasy, there's tension, sometimes headache and body pain associated, your blood pressure goes up with both, and both of them show a loss of sleep. But let's take a little deeper look at what the difference is. So with stress, that means that you are responding to an external cause. So maybe you have a big presentation at work, or you have a test coming up, or you're in an argument with a family member. Those type things cause stress. And it's usually not an issue once the situation is resolved or once a event has happened. So let's say that I'm very nervous about speaking at a conference in front of hundreds of people. Well, as soon as I'm finished, usually as soon as I take the podium and I get started, that feeling goes away. But that's different than anxiety. So let's take a look at anxiety. That is generally something internal, and it is a meaning, or the meaning of it is it's a reaction to stress. So when lots of stress is happening, and we don't deal with that stress maybe in the best ways, it can cause us to have anxiety. And this usually involves feelings of apprehension, dread, fear, and sometimes with no reason. I know that for years I have dealt with anxiety and anxiety attacks. We're going to get to that in a minute. But with that, learning how to cope and what to do when I begin to feel those feelings has made all the difference in the world. But it is a really terrible thing, because you're going along with life and all of a sudden you have this fear and this horrible, heart palpitations and panic and all these feelings, and you don't really know why. So these are the things that we're going to dive into a little bit. So what puts us at risk for anxiety or anxiety-related mental health issues? Well, here's a couple things, and you might fall into these. Shyness or feeling distressed or nervous in new situations. And that might have started when you were a kid. It might have started in childhood. Exposure to stressful or negative life or environmental events. So for you and for me, our stress may come from cardiac disease or cardiac events or situations that are maybe happening with your own health or someone that you care about. And so for me, a lot of stress and anxiety came on in my life when my husband was diagnosed with heart failure. You know, he was 28, I'm almost 4 years older. So I was 32, thought life was wonderful, had just bought a home, had a 3-year-old daughter, and then this happened. So this caused great anxiety and still does at times, but I'm learning how to deal with that anxiety and not allowing it to control me and steal my joy. So, you know, negative events such as diagnosis with heart disease or a heart event really can put you at risk. A history of anxiety or mental disorders with relatives. You know, these things often run in families. They can be genetic, just like physical situations. Maybe you have anxiety symptoms that are produced or aggravated by health conditions, and that's what we're talking about today. It could be thyroid problems, heart arrhythmias. It could be any type of diagnosis that you may have. And then you're virtual, so you can't throw anything at me. Caffeine. I know that everybody loves their caffeine, and I did too for a long time. I was addicted to coffee and I was addicted to Diet Cokes, which is even a whole nother level. And so, you know, I really had to come off of those. They were increasing my anxiety. They were increasing heart palpitations. They were making me jittery, and it wasn't good. So I will tell you, I am completely off of soft drinks, have been for a long time. And I even now, again, don't hit me, I do decaf coffee, and people look at me like I have two heads because I love coffee. I still want some. And, you know, there's still a tiny bit of caffeine in decaf. So, you know, it's just managing those things because all of these things make anxiety even more prominent. Okay, so we know that this could be a factor for you. It has been for me for many years. What are the treatments? What are the therapies? What can we do to combat anxiety disorders or just stress? What can we do? Well, the first thing that you can do is talk with your physician. And I know a lot of people are very uncomfortable with that, but we've got to get over that. We've got to move past that because they're our first line of assistance. They can connect us with the people and the things that we may need most. And then I also ask you to talk to family and friends for support. And again, ones that feel you, that are positive, that really care about you, that can be a support to you. So the first thing I'm going to encourage you to do is something called psychotherapy. And I know some people go, whoa, what is that, Jessica? Well, it just means talk therapy. It means that you talk to somebody. I don't really mind what form or fashion you do it, as long as it's with a trusted professional or a trusted group. So there are different things that you can do. We talked about it before. You can do one-on-one, or you can also do group or support group therapy. So let's take a look at cognitive behavioral therapy. So these two might be something that you want to look into or might be suggested by a counselor or a therapist or even your physician. First is cognitive behavior therapy, or sometimes called CBT. And one example of this that helps people with anxiety disorders is that it teaches people different ways of thinking, behaving, and reacting when situations happen. It just helps you to be less anxious and less fearful. So it could be things, you know, one of the things that I do are breathing techniques. It could be that you think of certain places, that you listen to certain music, that you call or contact a certain person just to talk to them or have them pray with you or talk with, you know, whatever makes you feel comfortable. I know for me, if I begin to feel anxious, one of the things that I do is I do breathing, but I also let my husband or my daughter know, and they normally pray with me, and that just centers me. And whether you're do prayer or meditation or just talking, you know, reaching out to someone you can trust and saying, I feel this way, I need your support is key. Then there's also exposure therapy, and that's a cognitive behavioral therapy method that actually exposes you to things that you're afraid of. So, you know, you might engage in activities that normally would cause you stress. So here's an example I use with people. Heavy traffic causes severe anxiety and stress in me. I don't do well with it. but I often have to drive on highways that there is really tough traffic. And so one of the things that a counselor told me to do was, when I know I'm going to have to drive in these situations, try, if I can, to do it at times in the day it's not as bad. Also, she said, listen to a podcast or music that relaxes you, or maybe even give someone a phone call that is someone you enjoy talking to, so that that kind of gets your mind off of it while you're in that traffic. And these things actually do help me. They actually do work. So just an example. Okay, now there are medication options, and for a lot of cardiac or heart patients, you may be prescribed an antidepressant. And if that happens, listen and fully understand before you take anything, but don't be completely opposed to it. Understand that, when something is happening in our brains, in our mental health, it's really no different than something happening in our physical health. So, we may not mind taking a heart medication, but then we don't want to take something for our mental health. And so that's where I want you to understand there's no shame in that. There's really no difference. So one of the things I want you to do is make sure that this is an open and honest discussion with your healthcare providers. There are lots of different medications out there. They're not all for everybody. So understand that you may even have to take a couple different ones to find one that works for you best. But there are medications that are specifically made for anxiety disorders. And again, I told you they're called antidepressants. And they are medications that just help you. They don't take the stress and anxiety away completely, but they help you to cope with it. So it is important that you choose the right medication. And I can't stress to you enough about this open communication with your physician. So some types of drugs may work better for specific types of anxiety disorders. So people need to work really closely with their healthcare provider to find out exactly what they need. Again, be wary of caffeine, over the counter, especially cold medications, any illicit drugs, of course, but even herb supplements or all natural things that you're taking. It could interfere with antidepressants. So make sure that you know about any foods or things you shouldn't drink along with those medications. And then people need to really talk and find out how to keep this, how to learn about which substances are safe, what to avoid. And then choosing the right medication and the right dosage is really key. So maybe you tell your physician, I'm not really feeling any different. They may need to up your medication. Or maybe you say, I'm feeling really sluggish or not good. They may need to lower it, or they may need to change it. So keep that line of communication open about how you're feeling. If you don't feel better, that's not good. You need to feel better. So make sure that you have that open communication with your doctor. Okay, we talked about support groups, but I got to give you a little disclaimer about support groups too. As great as they are, I want you to also be aware that everything that every member of the group says may not be accurate. So double check those things. If someone in your group tells you about this fantastic new medication or this fantastic new therapy, don't just take their word for it. Do your homework. Write these things down. Talk with your physician about it. It may not be that it would work for you. But you can do these again online or in person, and I highly recommend them. It just helps you know that you're not alone, and it gives you some great advice as well of how to deal with different things and learn from other people's experiences. So what are some stress management techniques? What are some things that you can do to work within this stressful situation that you may have found yourself in? And it may not just be health. It could be stress from family, from friends, from work, from your kids. It could be all kinds of things. So there are things such as exercise that is great for your brain. Mindfulness, that just really means getting centered, enjoying the moment, taking time to breathe. I find it really difficult to just sit down and do nothing, but sometimes we need to do that. And then meditation is really a great way to relax ourselves, center ourselves. And then also prayer. If you're a person that believes in prayer, that is a really essential thing to think about. So I love this graphic because it really shows you what are some simple things that you can start doing like today. And these are the top 5. And the first one is eating nutritious food. And this means not giving up maybe every single thing you love, but just being mindful of what foods do when they go into your body. Making sure if you're a meat eater, and I am, that you're choosing lean meats. It matters how we cook our food. We're huge air fryer fans at our house. We love our air fryer because it gives you kind of that texture, but there's no oils or grease involved. But vegetables and fruits are so key. We were made to eat meat, fruits, and vegetables. That's it. And if you're a vegetarian, fruits and vegetables all the way. But we were made to eat real food, not processed, not full of processed sugar, all these carbs that we eat in our diet. We weren't created to eat all that food. And it affects our stress level and our brains and our mental health. Finding exercise, something you like to do. We already talked about that. Getting at least 7 hours of sleep a night is critical to your mental health and relieving stress and keeping those levels low. 7 is minimum. My range is 7 to 9, whatever your sweet spot is. 8 hours is my sweet spot. If I'm less than 7, I am not myself. I am irritable. I don't feel good. It's just not a good thing. And sometimes I'll even warn people, hey, it's not you, but just heads up. I got 6 hours of sleep last night, and you can see them running the other way. Then drinking lots of water. But again, talk to your physician about this, because my husband, again, referring to him, he's my expert example. He has heart failure, so he has to limit the amount of fluids so that his fluid level does not get too high. So talk to your doctor, but please implement real, just plain water into your diet. And then the next thing is making a list. I don't know about you. I'm 48. The older I get, the worse it is that I forget things. So this is my saving grace, a little pen and a pad. I make lists. I mark them off. I keep them where I can see them. I have a calendar in our kitchen that we put all the events going on in our family on that calendar. It's okay. It helps. So do that. It'll help relieve some stress. So coping with stress and anxiety, what are some tips? Okay, well, everyone's different. So what works for me may not work for you, and vice versa. But here are some, just some suggestions, and you can take a few of these and start implementing them and see what happens. The first one is keeping a journal. That really seems like the old days, but I'm a journal person. I'll be honest, I haven't done one in a while, but it just helps to put your thoughts down on paper. You could do it on your device, you could type it out, or you could write it. There's just something about writing the words, writing out how you're feeling, good or bad. It's okay. It just gets it out. It's just very therapeutic. There are apps that you can download. Some are, have a cost, some don't, but they have relaxation exercises on them. You'll get tips throughout the day of how to be mindful, how to be focused. So all of these things are great. There's also different apps that you can have with sounds, people reading you stories, all kinds of things that can relax you. Exercise, eating healthy, and eating regular, routine meals, important. Sticking to a sleep routine as much as you can. We talked about caffeine, soft drinks, and coffee. Identify and challenge your negative and unhelpful thoughts. Okay. So I'm going to be honest with you. Last week was a stressful week. And my daughter said to me over the weekend, Mom, I love you, but I need to tell you, everything you're saying is negative, and that's not who you are. You're the most positive person I know. And everything you talk about is negative. And I just want to bring this to your attention. I did not get angry. I did not get mad. She was very brave. But I thought that was very awesome. Like, she loved me enough to say, you're not yourself, and all you keep talking about is the bad. And so we have to be intentional to redirect our thoughts to be positive. Did you know that? Like our brains automatically, if a situation happens, go negative. So let's take a look. Like this is simple. We get up in the morning, it's raining. We could say, oh God, it's raining and now I'm going to get wet and now I've got to go somewhere. And now, I'm going to get my shoes muddy. I'm going to have to change my outfit that I have. That could be it. Or we could get up and go, oh, listen to that rain. It's washing away all the pollen. It is helping my yard be green and my flowers grow. It's going to be a refreshing time after it rains. It's beautiful. I love it. It's new growth. So same situation, different mindset, but we have to be intentional and make ourselves be positive. So it's just, our mindset is everything. Reach out to friends and family members who help you cope in a positive way and show them some love. If they have been really helpful for you and they've shown you love and support, do something really cool and sweet for them. Send them some flowers, send them something on Amazon, send them a card, just a card. I can't tell you what a card means. For Mother's Day this year, you may think it's corny, but my 19-year-old daughter is not an affectionate person. Just physical affection is not her love language, but it is mine. So for Mother's Day, she gave me about 10 coupons for hugs. So I can take these coupons to her and I can get hugs. Let me just tell you, I'd rather have those hugs than if she had given me $100 bill. So think about how to show love to people who are supportive of you. Okay, so where did I get all this info? So I always share this website. This is the #1 referred website that I use. It's called Medline Plus. So if you're putting it in your computer, you can just type in Medline Plus. The actual address is medlineplus.gov.gov. This is a medical search engine that is sponsored and kept current by the U.S. National Library of Medicine. There are no advertisements. There's no unbiased information here. You put in what you want to learn about, and it gives you websites that were created for patients and community members, family members, for people that aren't medical professionals. And so this is a great site. There are videos here. There are all types of health topics, everything from a pimple to a diagnosis of heart disease. There are drug supplement information there, all kinds of things. You can look up medical tests here and see what it's going to look like or what this test does. The other thing I love about this site is it is 100% translated into Spanish. So this entire site is transferred into Spanish with just the click of that little orange Espanol button there. Now, you might be saying, Jessica, I need Portuguese, I need Vietnamese, I need Chinese, I need French. Well, we find that here in Central Florida, we are a melting pot. And so with that, you can also find some of those languages on this site, but I'm going to give you a place to reach out to that can give you information in those areas. This is it. So this is actually where I used to work, and I still have a wonderful relationship with this wonderful library. It's the Clifford E. Grace Community Health Library. It is found in Orlando Health. It is a part of Orlando Health, a health organization here in Orlando, but it is funded from an outside source, and their stipulation is that any and everyone can reach out to this library through phone, through email, and they can receive help from a medical research librarian. How amazing is that? This is free of charge. You just contact them and say, I'm looking for this. I'm looking for information about this medication or this treatment, or I've been diagnosed with this. Can you help me find some information? And then you know that you're getting credible, trustworthy health information. So this is a great source. So this is their phone number, and this is also their direct email. So you can email them, just let them know who you are and that you need information. All right, now what did I use today? I used Medline Plus that I just shared with you, and I also used NIMH, the National Institute of Mental Health, and also the CDC, Centers for Disease Control and Prevention. So these are the sources where I got all the information I shared with you today. All right, so that was a lot, but I'm handing it back over and you guys let me know about questions.
So much great information. Thank you so much.
You are welcome.
Fabulous. So we do have a couple of questions, and I just want to let everybody know, if you have a question, please place it in the Q&A. We have a few minutes that we can cover questions, and the handouts are in the chat that you all can go to. So this one is actually a great question for you. It's not really on mental health, but says, I was diagnosed with left ventricular non-compaction lumped into heart failure. Trying to find resources on this. Where can I go to find more information on this specific diagnosis? I'm assuming the library that you just referenced would be a great place.
Absolutely, yes. So that would be a wonderful place to start, because they will be able to do specific research on that specific diagnosis for you. So that would be a wonderful place for you to reach out.
Great.
Absolutely.
Great. I'm just going to check the chat box. And all right, I think that I'll give everybody one more minute to ask any questions. I love that you must have done a really thorough explanation, because there's not a ton of questions, so that's great. Our next session on our mental health and cardiovascular disease webinar series is next week, May 17th from 3 to 4 Eastern time. And this one is going to be on lifestyles after a heart event that affect your mental health. So I think that's also a really important topic that we need to discuss. My question to you, Jessica, is it important to share your mental health struggle with a close person, family member, as well as to a doctor? I think sometimes people try to do it by themselves and they're not sharing that information. Do you think it's really important for that conversation to happen?
Absolutely. That really needs to happen even before you maybe even talk with your physician about it. I think it's great to have a support person go with you to appointments. A lot of people are very private and they, think they can handle it on their own. But I am a huge advocate of taking someone with you that you trust to appointments. And especially if you want to have this type of discussion, I think it's just great to have them there. You may want them to even help share, if it's difficult for you, or they can even say, hey, these are the things I've noticed in them. These are the changes. This is, things that I feel like they need help with. So definitely share. This is not something to be ashamed of or to hide, because it will only get worse if that's what you do. So yes, I'm all about, we as a family, my husband will sometimes talk to certain friends alone. I would do that as the caregiver. We have couples that we trust that we often talk to, and then we together talk to counselors and also the physician. So I just think it really needs to be something that you're okay with talking about, that you're very comfortable talking about. And again, everybody's not going to be supportive. Everybody's not going to understand. But you being very mindful of choosing people that really care about you as a person. Those are the people that you need to confide in.
Yeah, absolutely. And I think that's really important. We do have one final question that popped in. Oh, so yes. So somebody missed the beginning of the webinar. The webinar has been recorded and it will be available on our website following the event, probably tomorrow, maybe not till Monday. It depends on how long it takes, but it will be available. So thank you again, Jessica, for sharing your time with us. It's always a pleasure. We really appreciate your expertise. Everybody who joined us, thank you for joining, and I hope to see you back here next week. So everybody.
All right. Thank you so much, everybody.
Bye.